Did you know that according to the Anxiety and Depression Association of America, OCD affects 2.2 million adults, or 1% of the U.S. population? It's important to be able to recognize the symptoms of OCD because it affects so many men and women. OCD is a mental illness that affects many parts of the patient's day-to-day life. However, it can be managed through a variety of treatment options. To illustrate this, we will look at the symptoms of OCD, how to diagnose OCD, and possible treatment options. To begin, let's look at the symptoms of OCD. There are several different signifying symptoms of OCD that can be observed. First are obsession symptoms. Obsession symptoms are things you cannot stop thinking about even when you're trying to focus on something. Obsession symptoms have a theme such as fear or germs. If you have a fear of germs, you would be afraid of being touched or touching things that other people have touched. Or you might need things to be a certain way, and if they aren't, you experience intense stress. Next are compulsion symptoms. Compulsion symptoms are repetitive behaviors you feel driven to perform. Compulsion symptoms also have themes such as washing, orderliness, and counting. Some may wash their hands until they bleed, set their M&Ms in color order before eating them, or count in certain patterns. According to the Mayo Clinic, most cases of OCD include both compulsive and obsessive symptoms. The severity of these symptoms tend to change over time. These symptoms tend to get worse the more stressed out you are. Severity also varies from case to case. Some have mild symptoms, while others experience some symptoms that hinder their quality of life. How can you tell if you have OCD or if you're just a perfectionist? Doctors may do a psychological evaluation. During a psychological evaluation, you'll talk about your feelings and your thoughts, symptoms, and behaviors. This will determine if your behaviors are affecting your quality of life. Doctors may also want to talk to your friends and family and just get a feel for things. The other option for diagnosing OCD is seeing if your symptoms match up to a set of criteria that doctors use from the Diagnostic and Statistical Manual of Mental Health. The other option for diagnosing OCD is a physical exam. Doctors will want to rule out any other possible underlying condition to make sure that's not the reason behind your symptoms. Now that we know the symptoms of OCD and the ways that it can be diagnosed, let's look at possible treatment options. According to the National Institute of Mental Health, OCD is typically treated with medication, psychotherapy, or a combination of both. Serotonin reuptake inhibitors, or SRIs, in the common medicine prescribed for OCD. SRIs are given in a higher daily dose when treating OCD, in comparison with treating depression. It can take up to 12 hours to 12 weeks to notice the benefits of this kind of medicine. Antipsychotics are also given to treat OCD, but there is mixed reviews in the research about the effectiveness of using them. Psychotherapy can also be used to treat OCD. Cognitive behavior therapy and habit reversal training have proven to be effective when treating OCD. Exposure and response prevention is a type of cognitive behavior therapy. During this kind of therapy, you basically do whatever triggers you, and then you are prevented from doing the compulsive behavior. This form of cognitive behavior therapy has lessened symptoms and has even been effective when medications have failed. Just like symptoms and severity vary from case to case, so do treatment options. Some need just medications, while others just need therapy. There are cases that benefit from a combination of medication and therapy. It may take some time finding the right combination of treatment, but it can improve the quality of life for people with OCD so they can enjoy life to the fullest. Again, OCD is a mental illness that affects many parts of the patient's day-to-day life. However, it can be managed through a variety of treatment options. To illustrate this, we looked at the symptoms of OCD, how OCD is diagnosed, and the possible treatment options. Next time you see someone sorting their M&Ms by color before eating them, instead of thinking they're crazy, maybe you can be a little more sympathetic to what they might be going through. Thanks.